This discussion is going to be Oncology, Chapter 6. Oncology is the branch of medicine that deals with the prevention, diagnosis, and treatment of cancer. Oncologists are medical professionals who specialize in the diagnosis and treatment of cancer and work closely with other healthcare professionals to provide comprehensive care to cancer patients. They may specialize in specific types of cancer, such as breast cancer, lung cancer, or leukemia, and collaborate with other specialists to develop personalized treatment plans for patients. Our objectives for today are to review concepts of normal cell division and differentiation, review medical terminology for cellular organization and tissue, identify the risk factors for genetic mutations that alter normal cell division, differentiation, and cell mutation, as well as apoptosis to create neoplasm, and recognize the role of the immune system in fighting neoplasm. Understand classifications, grading, and definition of benign and malignant. Understand that benign growths are not always harmless. Understand the process of metastasis, including the connection between angiogenesis and metastasis, and the downstream factors that affect likelihood of locations for metastatic growths, and explore the role of therapeutic exercise as a prevention modality of cancer. Our questions of the day are: a 55-year-old female patient recently completed radiation therapy for breast cancer. During a follow-up visit, the patient reports experiencing tingling, numbness, and weakness in her hands and feet. The patient is also fatigued and reports difficulty concentrating. Which of the following is most likely the cause of her symptoms? A. Peripheral neuropathy due to radiation-induced nerve damage. B. Anemia caused by decreased red blood cell production. C. Cognitive impairment from radiation therapy to the brain. And D. Lymphedema resulting from compromised lymphatic flow. Our second question is: a 42-year-old male patient is receiving chemotherapy for testicular cancer. During treatment, the patient begins to experience increased bruising, frequent infections, and fatigue. Laboratory tests reveal a low white blood cell count and low platelet count. Which of the following is most likely cause of these symptoms? A. Radiation-induced bone marrow suppression. B. Chemotherapy-induced bone marrow suppression. C. Tumor metastasis to bone marrow. Or D. Vitamin deficiency due to chemotherapy. A neoplasm, also known as a tumor, is an abnormal growth of cells due to uncontrolled or abnormal cell division. They can be benign, which is non-cancerous, or malignant, which is cancerous. Benign tumors grow slowly and don't invade nearby tissues or spread, so they do not metastasize. They can cause healthy tissues if large or pressing on vital organs. They can cause health issues, if large or pressing on vital organs. They have well-defined borders or encapsulated in fibrous capsule. They resemble the tissue that they originate from, named after the cell type. Malignant tumors invade nearby tissues and spread via blood or lymphatic system, also known as metastasis. They grow rapidly with uncontrolled cell division. They lack clear borders, infiltrate surrounding tissues, and are hard to remove via surgery. They can cause severe health problems and potentially life-threatening if untreated. This image is of a spinal cord neoplasm in the intradural space. Hematopoiesis is when hematopoietic cells give rise to all blood cells through a process called hematopoiesis. Normal tissues have cells of uniform size, shape, maturity, and nuclear structure. Differentiation is the process where cells undergo physical, structural changes to specialize in different functions. Neoplasm classification is based on cell type, tissue of origin, differentiation, site, or benign versus malignant. Benign growths are typically harmless and do not invade or spread to other tissues. Some benign tumors are just overgrowths of normal tissue, but can still cause issues if they grow large enough to compress or obstruct or impair normal functions. Tumors are named according to their tissue origin. The 5 major tissue classifications are epithelial, connective, and muscle, nerve, lymphoid, or hematopoietic. There are also miscellaneous category that includes tissues like reproductive glands, placenta, and thymus. Smoking and alcohol abuse are the most damaging risk factors. Some of the cancer risk factors and biological and health factors include advanced aging, previous cancer or treatment, such as radiotherapy, type 2 diabetes, inflammatory bowel disease, and the presence of precancerous lesions or polyps. Lifestyle and behavior risk factors include tobacco use, diet and nutrition, obesity, alcohol use, physical inactivity, and sexual or reproductive behaviors, and stress. Infections and viruses that are risk factors include HPV or human papillomavirus, Epstein-Barr virus, hepatitis B and C, herpes virus 8, and environmental and socioeconomic factors include exposure to carcinogens such as pollution, radiation, and chemicals, hormones such as estrogen and testosterone, occupational hazards such as chemical exposure or hazardous materials, socioeconomic status affecting access to healthcare, and heredity and family history of cancer, as well as gender and ethnicity depending on the cancer type. Some geographic and environmental influences include environmental factors such as air and water pollution, radiation, and industrial chemicals. Diets and lifestyle include diets high in processed foods, red meat, and low in fruits and vegetables are at a higher risk of colorectal cancer. High tobacco, alcohol use, and physical inactivity raise cancer risks. Rural and remote areas may lack cancer screening, prevention, and treatment services. UV radiation increases closer to the equator, where there's a higher melanoma risk. There is an increased risk after the age of 50. The risk of developing cancers rises significantly. The mean age of cancer patients is 70 years of age. Dysplasia refers to abnormal changes in cell size, shape, and organization with any tissue organ. Dysplasia itself is not cancer, but it may progress to cancer if left untreated. Common sites include the cervix, the colon, and the skin. Severity grading can be mild dysplasia, which is slight changes that may resolve on its own. Moderate dysplasia is more pronounced changes, higher risk of progression. And then severe dysplasia, which is significant cellular abnormalities and may be closer to cancer. It is critical for early detection and intervention. Prevention interventions include surgical removal of affected tissue and screening procedures like colonoscopy or pap smear. HPV is a major risk factor for dysplasia, especially in the cervix. The virus can alter cell structure and function, triggering abnormal growth patterns that lead to dysplasia. Cervical dysplasia is often detected through pap smears. This condition carries a risk of progressing to cervical cancer if not monitored and treated. Here is the estimated new cancer cases and estimated cancer deaths from 2016 in the United States by the percent distribution of sites by gender. Oncogenesis is the process through which normal cells transform into cancer cells. Key characteristics include the accumulation of mutations in genes regulating the cell cycle, DNA repair, and signaling pathways. Uncontrolled proliferation. Cancer cells divide excessively, ignoring normal regulatory signals. Immune system evasion. Malignant cells develop mechanisms to avoid immune detection. And metastasis, the ability to spread and invade other tissues. An oncogene is a mutated or overactive gene that drives uncontrolled cell growth through division. Oncogenes arise from normal genes called proto-oncogenes through mutations or alterations. The effects on oncogenes are hyperactive growth signals. Cells grow without external triggers. Inhibition of apoptosis. Cells avoid programmed cell death, accumulating more mutations. And continuous division, where cells divide indefinitely, bypassing normal checks and balances. Proto-oncogenes regulate cell growth, differentiation, and tissue homeostasis. The transformation of oncogenes include mutations caused by environmental factors, carcinogens, or genetic errors. Overexpression, where excessive protein production amplifies growth signals. And viral incorporation, where some viruses can insert oncogenetic sequences into host DNA. Tumor suppressor genes regulate cell growth, repair, DNA damage, and promote apoptosis. They have protective functions such as growth inhibition, halting cell division when abnormalities are detected, DNA repair to fix genetic errors to maintain genomic integrity, and triggering cell death, induce apoptosis of damage or if damage is irreparable. Loss of function. When inactive or mutated, these genes lose their ability to restrain cell proliferation, removing critical safeguards against cancer. Proto-oncogenes develop into oncogene, like a car accelerator stuck to the floor, driving growth without stopping. Tumor suppressor genes are like the brakes. When they fail, the car or cells race out of control, leading to cancer development. Pathogenesis is the process by which a disease develops and progresses within the body. Carcinogenesis is the multi-step process through which normal cells transform into cancerous or malignant cells due to genetic and environmental factors. Hyperplasia is increased cell number leading to tissue enlargement. Metaplasia is a benign, reversible change where one mature cell type is replaced by another better suited to withstand chronic irritation or inflammation. Dysplasia is disorganized cell growth with abnormal size, shape, or arrangement and is considered precancerous. Carcinoma in situ is pre-invasive localized proliferation of abnormal cells that haven't breached the basement membrane. Invasive carcinoma are malignant cells that breach the basement membrane and invade adjacent tissue. Metastatic carcinoma is cancer cells spread to distant organs or tissues via the bloodstream or lymphatic system. Oncogene activation drives relentless cell growth and proliferation even without external signals. Tumor suppressor gene inactivation removes cellular brakes, preventing normal growth, regulation, and DNA repair. Genetic instability is the accumulation of multiple successive mutations, fuels tumor evolution and progression. Staging describes the extent and spread of cancer at diagnosis. It helps guide normal treatment decisions, predicts outcomes, and compare treatment results. The stage reflects tumor growth, spread, and prognosis. Here's an example of a simplified cancer staging system. Stage 0 is carcinoma in situ or pre-invasive. This is where abnormal cells are present but confined to the original layer of tissue. They haven't invaded surrounding tissues. Treatment involves localized procedures, and prognosis is very favorable with early treatment. Stage 1 is early localized cancer, a small localized tumor without lymph node involvement or distant spread. Treatment usually involves surgery and sometimes followed by radiation or targeted therapies. The prognosis is often excellent depending on the cancer type. Stage 2 is larger tumor or local spread. The tumor is larger or has spread to nearby tissues or lymph nodes. Direct extension into adjacent structures may occur. Treatment includes surgery, plus radiation, chemotherapy, or immunotherapy. The prognosis is good but depends on the tumor size and spread. Stage 3 is locally advanced cancer. The cancer has spread extensively to nearby lymph nodes or tissues, but hasn't reached distant organs. A combination of surgery, radiation, and systemic therapies such as chemotherapy or immunotherapy. The prognosis is variable depending on lymph node involvement and response to treatment. Stage 4 is metastatic or distant spread. The cancer has spread to distant organs or tissues through blood or lymphatic system. Treatment involves palliative care, systemic therapies such as chemotherapy, targeted drugs, and immunotherapy. The prognosis is poor, but treatments can improve quality of life and extend survival in some cases. Why does staging matter? It helps to determine the best therapeutic approach. It helps to predict survival rates and disease course, and standardizes how doctors and researchers discuss and compare outcomes across studies and treatments. Local invasion is when cancer grows into nearby tissue and structures, where metastasis is where cancer cells break away from the primary tumor, travel through the body, and form new tumors in distant organs or tissues. So how does metastasis happen? First is detachment and local invasion, represented by A. Tumor cells lose adhesion to neighboring cells and invade surrounding tissues. B is angiogenesis. Cancer cells stimulate the formation of new blood vessels to supply nutrients and oxygen, promoting tumor growth. Newly formed vessels also create entry points for cancer cells to access circulation. C is vascular invasion, where tumor cells penetrate blood or lymphatic vessels, entering the bloodstream or lymphatic system. D is circulation and survival. Cancer cells travel through the body. They may adhere to blood vessel walls or form clumps with platelets, helping them evade immune detection. E is extravasation, where cells exit the circulation by breaching blood vessel walls at distant sites. They invade surrounding tissues and establish a foothold in the new location. F is the formation of secondary tumors. Cells proliferate at the new site, forming small clusters, also known as micrometastases. They induce further angiogenesis to sustain growth and eventually developing into larger, clinically detectable tumors. Key points to remember. Metastasis is a hallmark of malignant tumors and a major cause of cancer-related mortality. Tumor cells don't need to master all metastatic steps. Different clones may specialize in distinct processes. Why are the Why the lungs are a common site of metastasis. Blood from most of the body tissues drains through the superior and inferior vena cava into the heart. The lungs are the first organ to filter this blood, making them a frequent site where circulating malignant cells become trapped. The lungs have an extensive network of small blood vessels, and cancer cells can easily lodge in pulmonary capillaries, creating new metastatic sites. The 5 most common sites of metastasis are lymph nodes, liver, bone, lungs, and the central nervous system. Cancer cells often spread via the lymphatic system. Lymph nodes act as filters but can become sites of secondary tumor growth. The liver receives blood from the gastrointestinal tract via the portal vein and is a common site for metastases from abdominal cancer such as colon and pancreas. The lungs are the first stop for many circulating tumor cells and a common site for metastases from breast, bone, kidney, and sarcomas. Bone has high blood flow and unique microenvironment that attracts cancer cells. The bones are common in breast, prostate, and lung cancers and cause pathologic fractures, severe pain, and hypercalcemia. The brain is richly vascularized and frequent site for metastases from the lung, breast, and melanoma cancers, and can cause neurological symptoms such as seizures and cognitive changes. Factors influencing metastatic spread involve host factors that promote metastases, aging or dysfunctional immune system, increasing age, hormonal changes, and chronic stress. Also, factors that may slow metastatic spread include radiation therapy that destroys cancer cells or shrinks tumors, chemotherapy, which is systemic treatment targeting rapidly dividing cells. Anticoagulants may prevent cancer cell-induced clot formation. Steroids and anti-inflammatory agents can suppress tumor-associated inflammation. Symptoms can appear immediately or develop gradually depending on the affected organ system and tumor's location. Common clinical manifestations include pain, often a result from nerve invasion, compression, or destruction of tissues, weakness, which can stem from systemic effects like malnutrition or direct muscle involvement, vascular loss due to tumor-induced damage to blood vessels that can cause clotting issues or hemorrhage, fractures due to bone metastases that can weaken the skeletal structure leading to pathologic fractures, and polyarthritis, where inflammation in multiple joints sometimes linked to cancer-related immune responses. Paraneoplastic syndrome is a group of symptoms caused by substances produced by the tumor or by the immune system's response to the tumor. Symptoms arise remotely from the tumor site and are not directly caused by the local tumor or its metastases. Common manifestations of paraneoplastic syndromes include neurological symptoms such as muscle weakness, loss of coordination, cognitive impairment or personality changes, difficulty walking or balancing, endocrine disruptions such as abnormal hormonal secretions or Cushing's syndrome due to ACTH secretion, hematologic and vascular changes such as anemia, thrombosis or clotting disorders. Musculoskeletal effects include proximal muscle weakness, polymyositis, or dermatomyositis. Dermatological symptoms include persistent unexplained itching skin rashes. Medical management includes primary prevention Preventing disease or injury before it occurs. Intervention such as health education, immunization, regular exercise, a healthy diet, smoking cessation programs, and environmental regulations. Secondary prevention involves early detection and treatment to prevent progression. Interventions include regular screenings such as mammograms, pap smears, blood pressure, cholesterol tests, and colonoscopies, so that timely interventions can be implemented to reduce complications. Tertiary prevention involves managing and reducing the impact of an established disease or injury. Interventions include rehabilitation, palliative care, support groups for chronic conditions, and improving the quality of life for individuals with chronic diseases. Tissue biopsies are samples of an important diagnostic tool in the study of tumors. Tissue for biopsies may be taken by curettage, fluid aspiration, fine needle aspiration, dermal punch, endoscopy, and surgical excision. Tumor markers are substances produced and secreted by tumor cells and may be found in the blood serum. The level of tumor markers seems to correlate with the extent of disease. A tumor marker is not diagnostic itself, but can signal malignancies. Treatment options include surgery, radiation therapy, chemotherapy, and biotherapy that involves immunotherapy, hormonal therapy, bone marrow transplant, and monoclonal antibodies. Prognosis: about 65% of all diagnosed cancer patients have a 5-year survival rate. However, is poor for anyone with advanced or disseminated cancer. Physical therapy is involved to address side effects and resulting impairments. Also, understanding the side effects related to cancer treatments such as fatigue, diminished functional ability, and diminished ADLs. Chemotherapy uses anti-neoplastic drugs to destroy cancer cells. It is commonly combined with other treatments such as surgery, radiation, and immunotherapy. It targets rapidly dividing cells, including cancer cells. However, it does affect healthy cells as well, and common side effects include hair loss or alopecia, nausea and vomiting, fatigue, and increased infection risk. Chemotherapy-induced cognitive impairment, also known as chemobrain, involves symptoms such as memory loss, difficulty concentrating, and decreased attention. Possible causes include toxic effects of chemotherapy drugs on the brain, combined with stress, fatigue, and hormonal changes. It results in potential brain shrinkage. Thrombocytopenia is low platelet count in the blood. Leukopenia is low white blood cell count, reducing the body's ability to fight infection. Also, sterilization or sexual dysfunction, which can be caused by damage to reproductive organs and hormonal imbalances caused by chemotherapy drugs. It reduces fertility or can lead to infertility. Also, decreased libido, erectile dysfunction, and irregular menstrual cycles or menopausal symptoms. Radiation or radiation therapy uses high energy radiation to kill or shrink cancer cells by damaging DNA. It destroys hydrogen bonds in DNA strands, preventing cancer cells from growing or dividing. Free radicals are highly reactive molecules generated by radiation, metabolic reactions, and environmental factors such as pollution and cigarette smoke. Free radicals cause damage to cells and DNA. Antioxidants neutralize free radicals by donating electrons. There are different radiation treatment approaches. There's external beam radiation therapy, where external beams target cancer cells, or internal radiation therapy, where radioactive source is placed near or into the tumor. This can involve radioactive seeds or substances inserted into body cavities. It directs radiation damages cancer cells' DNAs. Radiation can be used preoperative to shrink tumors and make them operable to prevent the spread during surgery, or postoperative to prevent residual cancer cells from multiplying or metastasizing. Bone marrow is sensitive to radiation due to its rapidly dividing cells. Its effects can lead to anemia, which is low red blood cell count causing fatigue and weakness, leukopenia, which is low white blood cell count increasing infection, and thrombocytopenia, which is low platelet count causing bruising and bleeding. Other side effects include digestive tract irritation, fatigue, often linked to anemia or psychosocial factors. Radiation-induced malignancy is when radiation can damage healthy cells' DNA, potentially leading to mutations and increasing the risk of developing cancer later due to errors in DNA repair. Radiation therapy stimulates fibroblasts, leading to excessive collagen deposition, which results in the formation of scar tissue and fibrosis. The mechanism is activated fibroblasts produce collagen, creating an imbalance between collagen synthesis and degradation. This leads to tissue thickening and scarring. Atrophy is a secondary inflammatory response. Its effects include pain, weakness, and psychosocial impacts. Contracture of tissues is due to the fibrosis, where the tissue contracts and tightens. Bone changes can lead to potential issues such as leg length discrepancy, where radiation on one hip may affect bone growth on one side, leading to a difference in the leg length. And scoliosis, where radiation on one side of the body can lead to a curvature of the spine. Cognitive impairment, which can be from radiation to the brain, where radiation to areas involved in memory and cognitive function, and results in memory deficits and altered mental status. Peripheral neuropathy is where radiation can damage peripheral nerves, leading to symptoms like numbness, tingling, weakness, and pain in extremities, and can impair mobility and quality of life. Encephalopathy is a condition that affects the brain, altering the structure or function. Fatigue, which can be due to cellular damage, inflammation, anemia, hormonal changes, psychological factors, and cumulative effects. Rehab management involves exercise, including cardiovascular, strength training, and range of motion, mobility, increasing the quality of life and level of function, energy conservation, pain management, fall prevention, caregiver training, education, and recognizing signs of metastasis. Implications for the PTA. It is important to understand that these patients may be at increased risk of infection. Hand washing is essential, and notifying the PT or MD of clinical manifestations of infection is important. The patients may experience mood swings. It is important to monitor for complaints of pain, burning, numbness, pins and needles, and motor deficits. Closely monitoring patients' tolerance to exercise and other PT interventions through vital signs is important, and also assessing lab values. Fatigue is common but should not be discounted. Consider dehydration, malnutrition, anorexia, and sleep disturbances. Lack of exercise can lead to cancer-related fatigue. The PT/PTA team must determine the balance between exercise and rest that is effective for the patient. Possible effects on cardiac and other organs manifest months and years after treatment. Exercise guidelines, when used as preventative strategy, involve moderate intensity activity, 30 minutes a day for 5 days per week. For individuals with cancer, it is important to monitor vital signs and hematologic values. No exercise within 2 hours of receiving radiation therapy or chemotherapy. Monitoring nutrition, 15 to 30 minutes, of exercise, 3 to 5 days per week, at about 60 to 80% of heart rate max. Strengthening involving low weight and high repetition, as well as energy conservation techniques. Individuals with advanced cancer are prescribed based on individual needs and abilities. It is important to monitor vital signs, increase hydration, and initiate with non-weight bearing aerobic exercise. Red flags of cancer include sites of metastases being bone, lymph nodes, lung, liver, and brain. Clinical manifestations affecting one of the following systems, the integumentary system, pulmonary system, neurologic system, musculoskeletal, and hepatic system. The PT is not responsible for diagnosing cancer. The primary goal is screening for cancer to make sure that the patient's problem is within the scope of PT's practice. Other red flags include proximal muscle weakness, accompanied by changes in 2 or more DTRs. Changes in DTRs should be documented and be further evaluated by the PT. Night pain that is constant and intense at more than 7 out of 10. Not all people that have cancer do have pain. Chemotherapy and radiation toxicities can result in painful peripheral neuropathies. Do not use physical agents over tissues exposed to radiation. Do not use with individuals who have decreased sensation. Deep heating agents would exacerbate symptoms and promote neoplastic growth. So back to our questions. A 55-year-old female patient recently completed radiation therapy for breast cancer. During a follow-up visit, the patient reports experiencing tingling, numbness, and weakness in her hands and feet. The patient is also fatigued and reports difficulty concentrating. Which of the following is most likely the cause of these symptoms? The answer is A, peripheral neuropathy due to radiation-induced nerve damage. Radiation therapy can damage peripheral nerves, leading to peripheral neuropathy, which often presents with symptoms such as numbness, tingling, weakness, and pain in the extremities. Fatigue and difficulty concentrating could also be secondary effects of radiation therapy. A 42-year-old male patient is receiving chemotherapy for testicular cancer. During treatment, the patient begins to experience increasing bruising, frequent infections, and fatigue. Laboratory tests reveal a low white blood cell count and low platelet count. Which of the following is most likely the cause of these symptoms? The answer is B, chemotherapy-induced bone marrow suppression. Chemotherapy can suppress bone marrow function, leading to decreased production of blood cells, including white blood cells, causing increased infection risk, and platelets, leading to easy bruising and bleeding. Fatigue is a common side effect due to reduced red blood cell production. If you enjoyed this video, please make sure to like and subscribe.